Hey there. Hi, everybody. My name is Crystal. I'm with All Bodies Welcome Electrology here in Campbell, California. And I'm very excited to have Stephanie Shields with me here today. Stephanie is, I believe, like one of the thought leaders in our industry. And she's always kind of ahead of the curve, I think, as far as the technology and all the different tools they use for their business. So I always love talking with her. First of all, how long have you been an electrologist, Stephanie?
Oh my gosh. Okay. So I have been an electrologist. This fall will be 17 years.
Yeah.
And then I've been doing laser for 18. But I was raised in electrolysis. This is my, from diapers.
Oh gosh. Yeah, that's right. Because you and your mom do this together, right?
Yes.
Very cool. Awesome. So today I specifically want to talk about consultations, consulting our trans clients who come to us for something that I feel is probably one of the bigger decisions in their life that they make, right? That they want to transition to a different gender. Mm-hmm. And I know you and I both love to welcome anybody that wants help with their hair removal. And I know it's, there's some schools of thought. It seems like some people are a little hesitant in our industry to do it. I'm not sure why, but I feel like if I can help, I want to help. And when people come to me who are transitioning, I know the word journey is used a lot and overused, but I feel like it's a total privilege to be a part of their journey. And I'm more than happy to help. But I also want to make sure I set expectations clearly because it is a very long process. So since you do this and you train people and you teach people about this, I thought who better to ask all these questions of than Stephanie Shields. So Stephanie, tell everybody about where your practice is and all that good stuff.
So our practice is in Phoenix, Arizona. And our med spa focuses on working with all individuals. Transgender just happens to be our specialty, alongside of just like many electrologists out there, people with hirsutism, people PCOS, people who have massive hair problems. And yes, the fine details are out there, but we have been specializing in the trans community my whole entire life. And so when I speak on this, I'm speaking on this from a perspective of not only watching the community grow, but I'm going to speak on it from a place of like a practitioner as well.
Yeah.
We have had people fly to our practice for, like I said, I've been doing this a long time. So at least my entire journey as an electrologist, if not longer. Because I remember even before that, my mother, as a practitioner before me, did the same thing. And so we're talking, let's say, 20 years of people traveling from out of state, out of country to come to Sons of Pello because we did something that other electrologists were hesitant to doing.
Yeah.
And so even though we're in Phoenix and we're in the heart of the desert and it's not something that people think about as a destination for med spa services, we became a destination spot for transgender individuals to come to get prepped for surgeries.
And so they would fly there and stay there for like a certain amount of time until they got their
usually, so if someone's coming in for large volume electrolysis, that's what we call it. Large volume electrolysis is going to be anything that's longer than, say, 4 to 6 hours. We often do double technician clearings. And so you're doing 2 technicians working at the same time. And so you might be doing, just for example, last week we had someone come in, 2 technicians, 1 surgical prep, 1 face work, 6 hours each technician for 2 days. They did 24 table time clocked hours of electrolysis in 2 days.
Wow.
And so, but usually, and we're going to really talk about this. We're going to dive into this more, but usually I don't like people doing more than, say, 3 to 4 days max of your booking because of what it does to their morale, what it does to their skin over time. So we're going to dive into that down the road with some of your questions.
I can only imagine what it does to your nervous system after 2 or 3 days of electrolysis. You just be like, oh my goodness.
Yeah, it's the fight or flight. It really does come in big time.
The interesting thing, I was just telling a client of mine, cis het male, I don't know if he has the motivation. He just wants some hair, done. I said, well, electrolysis is a lot about motivation. If people have the motivation, they will be here. If it's just like, for fun, that's okay too. But, it usually peters out after a little while. But our trans clients, I'll be seeing them for a couple of years. They're here every week. like clockwork. Let's do this, right? So
Yes.
I don't have the benefit of having two people to work on them, but that would be lovely because I know they're anxious to have their surgeries, right? They really are, and I feel for them, especially after the pandemic, because all their surgeries got pushed out. I'm just like, oh, my heart. So I know they want it done quickly, so I do my best. But yeah, it's hard when you're only just one person.
Oh yeah, and I mean, one thing that we have as an advantage in our practice is we do have medical staff that can do lidocaine injections to take out the pain factor of that large volume.
That's awesome.
So one thing I will say to you and any other person that ends up watching this is, even if you are a solo practitioner and you have a girlfriend in your area who's also a solo practitioner, there are times where you guys can come together and work together to provide this locally. It's just, there are those little caveats, right? So if you're doing that kind of pair up, which I encourage,
sure,
because that means that someone doesn't have to have that expense to come see me. They can have it locally.
Right.
But there's going to be little steps that you have to do to get to that point so that you're able to do this.
Sure. Yeah. So Senza Palo is the name of your company.
It means without hair.
What is it?
Without hair in Italian. Senza pelo.
Okay, cool. In Phoenix, what is your website?
It's senzapello.com. That's SENZAPELO.com.
And then do you prefer people to reach out to you via email or phone call or?
So email, if we're going to be talking treatment timelines, people are coming and traveling into us, email is a great starting point because it can kind of lay the groundwork for what they need to do. But my front office staff is amazing, and they really do a great job of trying to explain the starting points of the process so that when the time comes that we do consultations, steps have been met to give them better pictures as they're trying to get to talking to an electrologist.
Wonderful. What's your email that they would use?
So it's info@senzapello.com.
Okay.
And the phone number is 602-246-1966.
Cool. And I'll put all that in the show notes as well. I guess the first question, again, I'm thinking about our audience as being our fellow electrologists, fellow practitioners, and then also possibly trans clients, because I know when you're a trans person, I know they're scouring the internet looking for anything that has to do with how quickly can I get my hair removed before my surgery. And a lot of times too, people just want hair removed from their face, I mean, not even just for surgery. So they're anxious, right? They're ready. Yeah. They want to have it done. So right, exactly. And then I know sometimes the doctors give terrible timelines, and then I hate for them when they're disappointed, but anyway. So how would a person look for, first of all, let's talk to the trans client. What is the trans client looking for in a reputable electrologist practitioner who's going to be able to do the work that they need to have done? What should they look for?
So some of the things that I think that any person should look for is an electrologist that is very eager to learn, self-teach about information in the community. So
lifelong learner is what I always say. Lifelong learner, always learning.
Lifelong learner. You have got to, your electrologist should be doing their very best to keep to the WPATH standards of care and making sure that they are in the know of self-teaching where the trans community is right now. Okay. Right. Because the thing is like I said, I'm just going to put some numbers out there. I'll be 36 this summer. And so for 36 years, I have been around the transgender community. And even in my 36 years, and let's say the last 18 of those have been as a practitioner. Just in that 17 years,
right,
I have watched terminology change amongst the community and amongst practitioners.
Sure.
I have watched technology change. I have watched timelines and information the adaptation change all throughout this, not including the insurance side of things, not including the medical side of things. So an electrologist that does their very best their very, very best to make sure that they are in the know of those things will help you, the patient, find someone that is ready to take on the work that needs to be done.
Right.
I'm going to say this because I truly, truly, truly believe this. And sometimes I know it bugs other electrologists, but all modalities of electrolysis can kill a hair.
Sure.
Okay. And if you're the right candidate, laser can also get you there. Okay.
Mm-hmm.
But the thing is your electrologist has to understand that sometimes the work that's in front of them may have to shift to meet the needs of the skin.
Yep.
So when someone comes to me and says, what's the best type? Well, you are an individual, and an individual who, even at that, is having changes within their own health, right?
Yeah.
We're going on hormone replacement therapy. We're having growth changes. I mean, there's a whole bunch of stuff happening behind the scenes. So the best method is the one that electrologist feels most confident in.
Mm-hmm.
So making sure that they understand how to talk to you about that is incredibly important.
Yeah, I have one trans client. When I was working on her scrotal tissue, I tend to like blend or even straight galvanic on pubic hair, but I had to do some thermolysis on her scrotal tissue because she had some finer hairs. I mean, just within that one area, she had several different types of hair. And maybe it was because of the hormones, or maybe it's just natural. But I had to switch it up. You're right. I don't, as much as I love blend and straight galvanic, I have to, my machine does all three modalities. So I have to be prepared. If something's not working, I have to be prepared to try whatever is going to work and use what I learned and go, oh, you know what, this might be a good time for thermolysis, and then do that.
Yeah, it's so important. The right electrologist will know her craft.
Yeah.
Because at the end of the day, that's why you have hired us.
Right, right.
The other part is communication, right?
Yeah.
So if you are on the phone or you are emailing someone and their communication with you, just take apart the fact that it's already scary enough to make these phone calls when we're going through transition. Okay. If the communication is open and understanding to your transitional needs, then that's a good fit for you, right? But we all have places in our own heart where we're just like, oh, that didn't make me feel too good. Follow that, because it's important to trust your practitioner. You have called that person to do the job, and you got to find that trust. It's not going to be built in one phone call. You're not going to know everything you need to know about that electrologist in the one phone call. But if you have that opportunity to really build those foundations of trust, that's going to be the right space for you.
I think it's really important as a practitioner to really make it feel like a safe place.
Oh, yeah.
But because often there are situations where it's not safe for them. And I mean, like, mentally and physically. And so it's very important to make sure that they feel safe all of the time and comfortable all of the time. I mean, that's true for everybody, but yeah, this is like a big deal for them to reveal to you what they're doing, you know, and like say it like you said out loud. I had one client who, she said I was the first person that ever used her new name all the time and never used her other name. And the day she came to see me was the day she also let her employer know. And I was like, hey, that's as far as I'm concerned, this is who you are.
Yeah.
You are that person now. So I never knew the other person. I will never use that name. And I will, it takes a lot to make them feel safe, because it's a screwed up world sometimes. And we live in a nice place here in the Bay Area, but there's still people that are not very understanding. And anyway, I want to be one of those people that are understanding, that can support them and make them feel very safe.
And just the fact that you're willing to do this interview.
Yeah.
I mean, that's one of those things. These are those moments to go, okay, I am doing just a little extra to make sure that.
And some people, you are a C.P.E. I'm not a C.P.E. yet, but I will be one day. But I think that a C.P.E. certified, what is it?
Certified professional electrologist. So there's 3 certifications that outside of licensure, because Arizona is an unlicensed state. So unfortunately, you got one up on me. I don't get to have a license out here. Okay?
I'm LE.
You're an LE. So what that means is I did apprenticeship style education, and that's how I do education out here, right? But you got to go to most likely an accredited school.
Yes.
secondary education or post-secondary education accredited
Mm-hmm.
training facility. So that just means our education base is different, but
Right.
we both had training.
Yeah.
Our certification from there, a C.P.E, which is your certified professional electrologist, is done through the American Electrology Association.
Right.
There's also a great equivalency, which is through the Society of Clinical and Medical Hair Removal. They have a longer credential, and they are the CCE, and that's a certified clinical electrologist.
Oh, okay.
And then a CME, which is a certified medical electrologist.
Wow.
And the difference between those two is one does laser
Mm-hmm.
and one does not.
And you do laser as well at your clinic, right?
I do. I'm actually working towards a CME right now, just because
Okay.
apparently I like to have a bunch of letters at the end of my name.
Yeah, for sure. I mean, and it's an indicator to people that you know what you're doing, and you know your craft. And anyway, so the biggest question, of course, that this is for our electrologists, our colleagues, and for our clients. Everybody wants to know, how long is it going to take, Stephanie? How long?
How long? Oh my gosh, it's so funny that you actually asked this, because just today I did like a little TikTok for my clients.
Mm-hmm.
And the thing is like, okay, let's take the science of electrolysis. Okay. Electrolysis is permanent hair removal by breaking down the follicle utilizing current.
Yep.
Okay. Whether it's heat or galvanic, we're basically breaking down the bottom 2/3 of the hair follicle.
Yep.
Now, what makes the hair grow? There are so many factors. It could be medications. It could be hormones like naturally occurring within our body. There are many factors. It could be stress factors, which goes back to hormones. Yes. I mean, like, there's so many factors.
Pandemics,
right? We're all like, ooh,
we're all
there. So all those little factors change that timeline. But if we were to say a very generic timeline, I would say that you could easily inform a patient most permanent hair removal will be done in 1.5 to 3 years with those variables in play. Now, what does that mean?
Nobody wants to hear that.
I know that. But the thing is like, either we're going and moving towards an end goal, right?
Right.
Or we're not.
Yep.
Okay. So if we're trying to make forward movement, that timeline lets us know that if we keep to the consistency of our treatment plan for that patient, they should see significant permanent hair removal in that zone.
Yeah.
Now, you have dormant follicles all over your body.
Yep.
They're on your face, they're on your pubic, they are everywhere. And those dormant follicles, underarms, exactly, they are everywhere. And those dormant follicles, if you have the propensity to grow hair, can grow hair that's new in that area when the variables happen. So that means an electrologist could be just cruising right along, getting all those hairs out. But then she hits a boom, big wall. And we're like, what is all this new growth? And we're going, okay, looking at their patient medical form, right. We are like, okay, what's the new changes? And a lot of times what you'll find is that patients will have shifted a new medication, tried new supplementation, went on Rogaine, started doing like plasma PRP, all those little weird things that can grow hair because it's stimulation in those dormant follicles.
Right.
We'll get those when they come in, but we can't put that into the timeline.
Right. I swear. I tell my clients, some of the time we're just waiting for the hair to grow. It doesn't mean you have to come see me every week. If there's hair to remove, let's do it. But sometimes we're just going to be waiting for it to make its.
And when that happens, right, when that little surge happens, I like to tell my patients as they're going through their consultation, just know that those waves in your growth don't mean that it's not working.
Nope.
But it's like coming down the side of a mountain.
Right.
Okay. So we may start up here, right? And this was like the most hair you ever had.
Right.
And then as I'm working, we're dipping down. Okay. And then midway through, it picks back up. And then we're dipping down. And midway through, it picks back up. And every time we're coming down, exactly. Yes. So that timeline does not mean that it's not working. It just means that we're hitting that next growth cycle so that we can treat those hairs and break them down further.
that with my clients that are just people that are just having, like women who are having me remove hair from their face, I tell them, let's see what happens in 3.5 months. You know, they're so excited, right? Because it's gone. And they're like, yeah, I love this, Crystal. I love you, Crystal. I'm going to write a Yelp review and a Google review because you're the best. And then 3.5 months, they're like, damn it, Crystal. How it works. It's time to come back in. Let's do it again. Let's do some more, you know. That's just how the hair grows. So you have to see it through a couple of growth cycles.
Yeah, you can only go through what you grow through. I mean, like literally, you are going to be facing these moments. And when I'm doing my consultation, I tell all of my zappers that are listening to this, okay, when you do your consultation, this part needs to go in there.
Yeah.
It's not just saying we're permanent hair removal and we're going to get rid of your hair. It's telling to your patient, okay, so the average, let's go face work only. The average timeline of this zone is about 13 weeks. Now there are variables, right? So upper lip grows a little bit faster, chin grows a little bit faster, but cheeks, neck grow a little bit slower.
Slower, yeah.
So that what I'll tell my patients is, as I'm working that line in so that they're not having a funky grow out pattern, right? They're going to notice that some zones stay away longer.
Yeah.
And to focus on that. So like I have a piece of paper that I show my patients, like, this is the zone for your cheeks. This is the timeline for your upper lip. This is the timeline for your chin. And these are all like based on science, right?
Yeah.
Watch your treatments to match those timelines. If, you know, goodness forbid, like you don't follow the pattern that we're giving you, know that that's the first place you're going to see that change, is because when your electrologist gives you, I like to give my patients like a 4-month timeline, so that I'm going past that growth cycle, right?
Right.
And I'll say, I am going to be having a steady treatment plan for about 3.5 months. And right around that 3.5 month mark, I am going to reevaluate how this hair is growing in, so that when 4 months rolls around, we're making your next growing timeline. So next 4 months of treatment. So you always know, I'm not booking you from treatment to treatment. I'm booking you a series of them so we can get you through this.
Yeah. My little dots represent 26 appointments. How do I do that?
Perfect.
But the timing could be different for the different clients. But yeah, I just try to tell them 2 growth cycles, you know, and then it's going to taper. I promise it's going to taper. It's just in the beginning, it's a lot, right? Because we want to get a jump on it. But then we have to be together through a couple of growth cycles to really get it all, and then put you in maintenance mode, right? Where you come see once a year for the randoms.
Exactly.
Once a year or whatever. So yeah, okay. 3 years sounds like so long, Stephanie. But why is it important to make sure every hair is gone?
Well, okay, let's talk about surgical prep. Okay. So if I'm talking to a patient that's going to be prepping for a surgery, and that hair is going to be inside the body, I cannot give you a solid answer as an electrologist that your surgeon wants, that you are ready for surgery, if it's anything less than a year.
Yeah, no.
And the thing is like most surgeons are booking at about 1 year to 2 years out for yes. The thing is anything less than that year, I'm only getting 2.5 growth cycles for that area. And that means I've only gotten to break it down just a little bit. Now, if I want to give you, like, if you want ease, knowing that you're walking into, you know, surgery with no questions at hand, you're not going to have, let's talk M to F, you're not going to have intervaginal hair growth. F to M, you're not going to have interurethral hair growth. Okay.
Right.
So what that means is the graphed area, the mapped area that surgeon gives you needs to be clear of hair growth for more than 13 weeks for me to say you have permanent hair removal in that area. Yeah. So if you can at least, at a minimum, if you know that surgery is out there and you're like, you know what, I know I can reach all the hairs on my face, but my surgery, I need this, right? If you can see me for surgery prep, or you for surgery prep prior to getting the supplemental stuff that the rest of the world sees underway, that means that I can give you that clearance without having those fears, because once it's inside, there is not a technology out there yet Okay.
Right.
You can go like this all day long, but there's
Yeah.
not a technology out there yet that I can get in there
Right.
and truly remove anything that I couldn't get pre-surgery.
And it's really a problem if there's hairs growing inside of the new vagina. Like, it's not just like not attractive, it's an issue, right? It's like,
Yeah.
it can cause other problems for your body.
I mean, bacterial problems, it can cause infection, it can cause scent issues,
Odor,
it can
yeah,
cause
odor.
irritation for your partner. I mean, like, there is
So many.
so many things. And
Yeah.
this is a once in a lifetime opportunity for you to feel whole.
Mhm.
And your electrologist is not trying to slow down the process for you.
Not at all.
We
Not
just
at all.
want to be able to make sure that at the end of the day, if you've invested, let's say, vaginoplasty, like let's say the average is $25,000, right?
Right.
And you're having to pay that out of pocket, just know that you should factor in the electrolysis cost approximately. And you should say, this investment, make sure that my $25,000 investment to my health for my dysphoria is without stress. Okay?
Right. Yeah, exactly.
And the same thing, phalloplasty. I mean, phalloplasty without insurance is like $90,000, I think is the average right now. Okay. So if I have to, in phalloplasty, the area that we have to clear is so small. Okay.
Yeah.
Everything else can be done after surgery.
Sure.
Easy peasy. There's very little pain working on the phallus post-surgically.
Right.
But that urethra, that like 9 inches by like 2-inch window that we have to clear for the urethra, if that's not done before surgery, you can have hair growing inside
Right.
your urethra, which means crystallization of urine. It could cause other issues. Let's just get it done soon.
Yep.
And then take care of what is accessible afterwards.
Yeah.
So,
right. Maybe some people don't understand. Like, so some of our fellow practitioners. I wonder if all of our fellow practitioners understand how. I think you're for some reason seems like your signal's going in and out.
Oh,
you can hear me?
I can hear you. Can you hear me?
Your audio's good. Your video is off a little bit, but
oh no,
hopefully it'll catch up. It's okay.
Okay.
I was going to say maybe some of our electrologists don't understand exactly what happens to the scrotal tissue and the labia tissue and stuff. So maybe would you just describe that real quick? How they're going to use it for the surgeries?
Absolutely. So let's talk vaginoplasty first. So most surgeons, not all, are using scrotal skin and the penile skin to create the vaginal canal. So when they do this, the biggest thing that we're going to face is that hair. They're going to basically, when we talk about scraping and stuff, I'm going to go back to this in a second. But we need to make sure that all of that is done, because what they're going to do is they're going to create a tube with that skin and then sew internally. If they're talking scraping pre-surgery, they are only talking about the follicles that are actively growing at that time. That means that if you got 2/3 of it done with electrolysis, that last 1/3, they are basically taking the tissue. If this was the outside of my scrotum, okay, and they're going to flip it over, and they're going to take a pair of medical shears, and they're going to cut the papilla of each one of those hairs so that it's hairless. But that's only when hairs are attached to the papilla.
Right. It's not always attached.
It's not going to get done. It's only what's actively growing at that time. Right. So that's going to be what's creating the inside of the vaginal canal. You can, in some cases, reach part of the vaginal canal utilizing it's like literally the thumbnail's distance, and it's only us stretching outwards, just like a cis vagina. Like it's stretchy, right? But like we don't want to stretch that new skin. We don't want to put all that irritation on it. So let's just get it done beforehand.
Before is much better. It's so much better, but it's so hard because they get so much different information from everybody, and then we're saying 1.5 to 3 years. That's a big span. But we just can't. We want to give you an exact date, but we just can't. because
Yeah.
also pubic hair grows very slowly and goes dormant for a long time, and we're waiting for it to grow so we can kill it. But sometimes we're waiting.
Yeah. And the cool thing is, okay, so in our practice, we do laser hair removal as well, right? And I could knock out a bunch of hair with laser hair removal,
Sure.
especially in the pubic region. I mean, like,
Right.
that is like prime laser hair.
It is, I agree.
That is the place to have it done. But the thing is it can also put stuff into dormancy, right? Because it's getting stuff that's below the surface of the skin. So if this is, I'm sorry, if this is my epidermal layer, right? The laser is going by color. So when the laser comes down, it is targeting the color of the hair on every pulse. Okay.
Right.
If the target's not there, then nothing happens. But if it's not growing, it takes longer for it to come back in. And so that target is not there for me to treat with laser, but it's not there for me to treat with electrolysis either.
Right.
So if you are thinking that you're going to have a laser right before surgery and you'll be fine, you're doing just as good as you would be if you were scraping the follicles. And that's about it. Now with your refill, the F to M, when we're doing that area, we have two factors that I like to tell people about. One, depending on how long you've been on hormone replacement therapy, testosterone hormone replacement therapy, we don't know how strong those hairs are going to get, because just like natural puberty happens where testosterone builds over time in the body, the same thing is happening. So if you are a guy going into this and you're like, I'm going to get this done now, I barely have any hair on my arms, but you're still taking testosterone to get you through your transition, you could have some pretty sizable hair growth if you're not doing your electrolysis on like a good regimen. And it's just because like the dormant follicles can come alive at any point. It's that's just par for the course when it comes to dealing with testosterone. I mean, it builds over time.
Right. Yeah. It's cumulative, right? So it just builds up, builds up, builds up. And then when you're somebody like me who just had a radical hysterectomy, and now you have very little estrogen or progesterone anymore, now the testosterone is like, woohoo! Let's grow some hairs.
Yes.
It's running wild.
I feel it. And like the thing is, I have PCOS. So at the end of the day, I'm an Italian woman with PCOS. Thank you very much, nature. You gave me hair and you gave me testosterone that does not know how to act right. And the thing is, like, we understand for our patients how much. I mean, like, there are very few electrologists that go into this industry not having a hair problem to start with. Like, we're all healthy sisters.
There's one cute woman that I've known in the area in Santa Cruz, and she's like, I want to call myself the bearded electrologist because she also has PCOS, and she's like, yeah, I understand, because look, she sees my teacher for her hair removal still, just when you have PCOS, especially if you're not taking medication for it, right? It's just like on forever and ever and ever and ever and ever. But whole different story. We'll have to do another story, another video about that. When your clients arrive, how do you help them feel comfortable? Because I mean, I know some people are not super comfortable around penises or scrotums or vulvas or vaginas, and when you're the person with those parts and you have the dysphoria about it, you want to make sure that when they're on your table, they can feel comfortable disrobing, and how do you help them with their modesty and just make them feel very comfortable? Like, I always say it's like looking at an elbow. I mean, it's all the same to me. I don't feel any weirdness or at all for me. So I'm just like, do this, but I know some people have that. And so how do you make them feel comfortable with that? Exposing the parts they want removed, the parts they like the least, basically.
So dysphoria is a very difficult thing for so many people on so many levels. And it does go past transition, because you and I both know that there are people that have dysphoria for a number of reasons. One of the biggest things I will say is that one, we have a very clinical approach to hair removal. I tend to call them patients, not clients, okay? Because in most cases, I'm seeing them for a medical reason.
Yeah.
And so there's that, right? But when you walk into my treatment room, I'm using a gynecology table. I am using paper dressings. You have, you guys will all laugh when you come to Sensapello and you see this. On the table, we have a puppy pad that goes underneath your butt. They're Chuck's pads, but every patient's like, those are puppy pads.
Right.
And then we have one that we use for draping. Okay. So one that goes under, one that goes above. Just to, with the lidocaine injections, there's possible blood contamination that we want that to soak into the pad. And we are taking a very clinical approach to this. The other part of this is and I teach this to my girls in the office, skin is skin is skin is skin. The only thing I need from you is shower within the hour or right after a bowel movement before you come see me. Okay. So we have a nice clean area.
Yep.
So there's that, because I can't work in compromised skin.
Yep.
So taking that like fear out of like, do I smell right? Do I look right? Like, take that out and just do that prep. Right.
Yep.
And then, like I said, skin is skin is skin. And so I am using the drape, and I keep barriers between my patient. I'm wearing gloves. My patient is not going to be touching the area themselves. When we do talk about like surgical prep, when we're working on a scrotum, right? Sometimes I only have two hands, right? And so those two hands are working. And so sometimes I might have a patient hold their tissue in place, right?
Help you pull it, help you stretch it a little.
Help you pull the skin up so I can work in there. But they're not putting their hand against their skin. I'm giving them a barrier to remind them that like, this is just part of the process so that we can get through this, so that it's not as intense.
Awkward. Yeah.
The other thing is like, and I encourage all electrologists to take this standpoint. It is 100% okay outside of work to have conversations about sexuality and openness to talking about one's body. But your treatment room is not that place.
Nope, I agree.
Many people have been through traumas regarding their genitals that you will never even know the story to, nor should you ever have to know the story to.
No.
And so to not make a big deal and make sure that the conversation does not go to one's intimate details of their own life helps remind them that you are in a clinical spot. And so the conversation should always stay very clinical, very in regards to that area. You can talk about life's woes all day long, but it should not have anything to do with someone's dysphoria in their genitals. It's just not it's not an appropriate space. An electrologist shouldn't be talking to you about that. I strongly believe in that. And so like when I'm talking to a patient, we're not using street terms to talk about their genitals. We are talking in a clinical way so that they understand this is what I have to do with this.
Right. Yeah. And I think that helps people to feel more safe too. If you're not delving into whatever their process has been or whatever even just sharing your own trauma is like, no, it's not the time. They need some safe space where they can feel like this is just something that has to get done. Not that it's like a big deal or that it's some kind of special thing that they're doing. It's just something that we do. Like you said, it's just more skin. It's just skin. And maybe talk about the basketball game and the local hockey team, but you don't need to get into things that are personal, because you never know what could trigger somebody and what trauma they, like you said. And it's so important because there's a reason why this is a delicate situation, and you don't need to be a part of that. Like just let it go and just keep it professional and keep it light. And you don't need to understand any more than that. It's not your business, really. If they want to share, of course, people can say whatever they want, but I don't delve into this. I just want to make them feel safe and not like they're different or something. I want them to feel like just
trans is more common than people realize. And at the end of the day, the conversation doesn't need to be about anything that you can't research online.
And you might already love and know some trans people. You just don't know that they're transitioned. So
Absolutely.
just shut up. And
yeah, absolutely.
love everybody. Kindness is it's free and it's easy to hand out. And yeah, it just make people feel like everybody deserves dignity, respect, and love, and don't make them feel othered as they already feel othered. So we don't need to make that worse. So that's really great advice, Stephanie. I really appreciate that. What
One
else?
of the greatest things that I heard, I'm going to just say this real quick.
Yeah.
An electrologist friend of mine, one of the greatest things that we had talked about after, because I teach this often to other electrologists about how to work with the community. And one of the things that she said to me, and I was like, gosh, that is the best way I've ever heard it said, is that you are not here for my entertainment. Okay. I mean, and I could be entertaining to you. I'm just a part of your transition, right? But at the same time, you're not here for my entertainment. So you don't have to give me the stories of your life unless you want to.
Right.
But I want you to open that door. And I want you to be able to like say, I'm safe enough to talk about whatever this is. But if you need to be on my table with headphones in and be in another place so I can get these hairs off, by all means,
yes,
I have a job to do.
Yep.
And that job is to help get you to where you need to go. And so whatever that is, whatever that distraction technique is, let your electrologist know, because they don't have to hear all of that. They don't have to. We love to hear about your story. Don't get me wrong. All day, every day.
Mm-hmm.
I feel blessed when someone does, for lack of a better word, does tell me their story, but it's not necessary unless you want it to be the case.
Yeah. I want them to do whatever makes them the most comfortable in that moment. And if that means no small talk and they want to put their headphones on and listen to a book, or I am here to make you comfortable and remove your hair. That's it. You don't have to chat with me. You can do whatever. And also sometimes it is painful, and I want them to manage their pain any way they want to manage it. And I'm here to facilitate that.
Absolutely. Absolutely.
Yeah. Anything else that you think electrologists really need to know? I mean, like you said, there's no one modality that's best. We don't, there's possible that you might use all three modalities in a session.
Absolutely.
There's no one special probe that you're going to use or one special anything. I do have some clients that like to use EMLA. I have another client that uses like a lidocaine that's from over the counter that's like a felt, and they just put it all over everything. And then as I work that area, I kind of remove it, I push it back, and then I go to town. But what else do you think what do you think electrologists need to know?
Well, one of the big things that I get asked by electrologists is so many of us are solo practitioners. They don't work with like a team setting like I do.
Right.
This is probably the hardest conversation to have with patients, but creating a place from your website to your phone call to your in-person, everything needs to be cohesive. Like it has to all blend together. We talk about branding in this world, right? So what is your brand speaking about your practice, right? Because so many of the things that you think you need to ask your patient, you might be able to put in play even before they find you, whether it's like search words on SEO, like search engine optimization, right? Or if it's information on your website, or utilizing your social platform to kind of disarm the fear behind electrolysis.
Yeah.
So much of this helps get you to that point, so that when somebody walks in your door, you're able to just get to the job at hand.
Yep.
So I think that, take a good look at your practice and say, okay, what if I was searching on the internet for gender transition, for electrolysis, what would be the thing that I want to see? And even have like people in your friends and family circle, right? Go to my website and just like, if you are comfortable working with the community, awesome.
Yeah.
Make sure you are shouting that from the rooftops, because not everybody is.
Right.
And if you're not comfortable working with the community, it's a bummer. Like, you really have a moment. But if you're not working with having comfort working with the community, then I would say ally yourself with electrologists locally that are.
Smart.
So that you're like, hey, I haven't made this my specialty. I don't want to like guinea pig on the individual in front of me, right? But
Yeah.
I do have friends in the area that can work on you.
Yeah.
And being able to ally yourself with other electrologists that do it, that are comfortable with it, that have been doing it, at the end of the day, that shows you're comfortable with transgender, not necessarily working on their caseload, but
Right.
like working to find them the allies
The
for them.
solution. Yeah.
Puts you in the right space. I mean,
Yeah.
I go back to skin is skin, hair is hair.
Yeah.
But if you are a chin and eyebrow person, and that's all you ever want to do is chins and eyebrows all
Right.
day, every day, just make sure that you find someone that can do a beard.
That's a great
or
idea.
do genital work.
That's a great idea.
It's going to help people out so much. Don't be like, oh, just go look online, type it in. That patient doesn't want to hear that. What they want to hear is like, hey, it's not my specialty, but my girlfriend down the street, she's good at it.
That's a great idea. I love that. And then what would you say to any person who is considering a transition that's out there, and maybe they see this and they watch it and they're figuring out what to do next? What advice would you give them?
Well, it's never too early to start electrolysis.
Yes.
I mean, if you don't like the hair now, you're not going to like it later.
Right.
It's going to require time dedication. It's going to require financial dedication. Okay, those are things. But we are at a time in our life where we are having to be our own advocates for our own healthcare.
Yep.
Okay. And so even if you're getting denied, appeal.
Sure.
Even if you aren't sure how far down the transition rabbit hole you are going to go, it's okay to take hops to that rabbit hole, right? Yeah. As you're getting there. But like, just know that you only have to go as far as you're comfortable. And then if you don't want to continue doing a service, or you don't want to continue like going on hormone replacement therapy or whatever it is, you have the control to stop. And it doesn't have to be everybody's business. Because the thing is, like, people want to be like, oh, well, this person detransitioned, or this person did this. And it's like, oh, they were doing electrolysis, but they stopped. It's nobody's business but your own. And the cool thing is most electrologists follow HIPAA.
Yeah. Mm-hmm.
And so at the end of the day, one, make sure you're going to someone that's HIPAA compliant.
Mm-hmm.
Okay. But it's when you stop, that's your journey.
Yeah,
and
totally.
You could be 5 hairs in and be like, oh, no, thank you.
I've had a couple of clients that just start out having an orchiectomy. Mm-hmm. And so that means they just they had their testicles removed, mm-hmm. and still have their scrotal sac, and then years later decided that they want to have the full surgery. Yeah. So it's interesting to work on people that don't have the testes in there, because it's actually just, there's not as much moving around, so it's much easier to just get in there. But yeah, they just decided later, okay, now I'm ready for the whole thing.
Yeah, I mean, transition can be in steps. It does. Sure. I mean, and there is no one way to transition. There is no like it is your transition. Yep. What I will say is people who have orchiectomies, okay, or individuals that don't have a lot of tissue down there, your skin is it's so important to your transition, or for surgery purposes, that if by chance there's any possibility that you're going to need that skin later and you don't want to have graft skin, one, get your hair removal done.
Yep.
Okay. Because at any point you're going to be good to go.
Right.
So get your hair removal done. And two, make sure that if you are tucking or using a gaff or whatever you're doing to compress, mm-hmm. That you're still treating your skin well, because your skin can get compromised very easily. And so whether it's using a proper moisturizer or whatever it is, make sure that it's pliable, because if they're trying to stretch it out for a vaginal canal, yeah, it needs to be still stretchy.
Yeah.
Yeah.
I have one client that there's definitely lack of moisturizing for a lot of years, and mm-hmm. it's challenging to remove the hair, but we're getting there. It's just challenging. But,
I mean, it's one of those things, like when I think about people that have not treated their skin well, unfortunately, pre-transition, most people are trying to hide any femininity that they're not taking good care of their skin.
Right. Yeah.
And so your skin is a canvas, right? And that
Mhm.
canvas has to be treated well for the paint to look good on it.
Right. Yeah.
And so if you aren't doing those things, then you might not have the great post look that you're going for
Right.
with hair removal.
Right.
So whether it's face work or surgery prep, okay,
Yep.
cleanse, moisturize, tone,
Yep.
SPF, like it's your new religion. Like these are
Totally.
things that make your skin look feminine
Right.
through the process of electrolysis, because electrolysis, your hairs create volume in your skin. And when you
Yeah.
remove that volume, you get a lot of laxity.
Yep.
And so if you're not doing what you need to do to protect your skin throughout the process, it's not going to look as great as you want it to.
Right.
Throughout the process.
Right. Yeah. You just never know. And it, like you said, there's no one way to do it, but that was kind of new to me when I first got into this. And then I was like, oh, I didn't even know that they did that. In my head, I was thinking that, Beth Grace went and did all the research, and I was like, oh, okay, I get it now, and just these people just decided later, yeah, I want to do that now. And so, okay, thanks for telling me. I'll just do the research on my own. I'm not going to sit there and ask them a million questions because it might be traumatizing for them. And so I just go to Google. Google has all of that information out there, and I educate myself. And now I was ready for the second person. And I was like, okay, I got you. I know how to do this. I got it. But there's the two situations are so different because I think one, they just wanted to just act like that wasn't there, so there wasn't a lot of, taking care of it and pampering it, so to speak, like you would if it was your face or whatever. So whatever, it doesn't matter. We're making it work, we're getting there. It's just step by step is all we can do. And, I keep telling them, don't try not to rush your surgery. I know you really want it, but we need the time to make sure it's all gone forever. And all the dormant pubic hairs, they drive me crazy, but they just take so long to grow. And nothing I can do about it. I can't rush it. I want to rush and if they're taking female hormones, then too, I think that's
slows everything down.
Yeah. Mm-hmm. And then I think also it might also amp up the pain too a little bit. So,
I mean, it's that one's, I like to see what trends are. Mm-hmm. And that trend hasn't been consistent enough in the years I've been practicing to really know if that's it. What I have found is if you tend to be a sensitive individual, if someone pinches you, you're going to be a sensitive individual with somebody doing electrolysis, right? I mean, pace yourself. We don't have to do hours of electrolysis. And if what gets you there is an hour in the morning and you go to work and you come back an hour in the evening, we can do that. Like the treatment plans are customized for a reason. I mean, it's a pain in everybody's schedule, right? But it can't be done.
It's a good idea.
Yeah. So,
Wonderful.
I mean, but pain's pain. People, they have varying. Yeah.
But I do like to, help make it as comfortable as possible. I'm sure you do too. But there's sometimes there's going to be a little pain, but hopefully the outcome is worth it, right? And I'm so thrilled to be a part of it, even if I'm just one little baby step. I would love to help anybody with their extra hair, and it just has a little extra meaning when people are transitioning, I think, because it's such a big deal, and I want them to feel whole, and I want them to feel, in their body and love it and feel like they identify with it all. So that part I feel makes me I get a little emotional sometimes. So I'm like, oh, I want to help, I want to hug you, but it's COVID. Otherwise I would, if I have to.
Cooties are a thing.
Because it's a lot, I feel like it's so much.
Yeah, it is a lot. And we're just here to help get along.
Yep, exactly. You're wonderful. Thank you so much for all of this.
Oh,
put all your contact information in the notes, and then let's do another video one day about PCOS.
Absolutely, my pleasure.
You're wonderful. Thanks, Stephanie. Talk to you soon.
Thank you so much. Talk to you soon.
Sounds great. Bye-bye.
Bye-bye.